What do you call a mixture of morphine, cocaine, and alcohol? Well, according to Thames TV, it's called a Brompton cocktail. And that's how hospice patients used to be treated to medicate their physical pain. There was no acknowledgement that there could be pain coming from other sources. I would like to talk to you about Dame Cicely Saunders. She is, according to Wesley Smith, she's the founder of modern day hospice movement. The three aspects of Cicely Saunders' life that we will be focusing on today will be her educational background, her motive for starting hospice care, and some of her major life accomplishments. Cicely Saunders was from a prominent English family, and at that time, wealthy families sent their children to boarding school. So at the age of 10, she was sent to Southland boarding school, and at 14, she was transferred to Rodine, which was one of England's exclusive boarding schools for girls. In 1938, at the age of 20, she attended Oxford University. She studied politics, philosophy, and economics. And in World War II, when that started, she dropped out due to wanting to be able to help the war effort, and she decided to become a nurse. In 1940, she attended the Nightingale Training School of London, which was part of St. Thomas's Hospital. After a back injury forced her out of nursing, she returned to Oxford and graduated there in 1944 with a diploma in public and social administration, and she became a social worker. There were many things that she saw that needed to be changed in the healthcare system in regards to treating patients that were terminally ill. But she was told repeatedly that if she was going to make changes, she needed to become a doctor. So back to school she went, and she became a doctor in 1957 after attending St. Thomas Medical School. Cicely Saunders had many motivations for revamping the hospice care movement. Her primary reason was David Tasma. Tasma was a 40-year-old Polish patient who had terminal cancer. She met him while she was a social worker at St. Thomas's Hospital. They only knew each other for a few months, but during that time, she gave him great comfort and friendship during his dying days. Because of this, he left her 500 pounds and told her that he wanted to be a window in her home someday, and he was talking about the hospice home that she was going to build, that they had talked about. Cicely came to realize that physical pain was not the only pain that needed to be treated during the last phase of a patient's life. So she started treating patients' total pain. She considered a patient's total pain as not only the physical pain of dying, but it is also the social, spiritual, and psychological pain that a person experiences during their dying days. She also wanted to establish a place of research and education that terminally ill patients where doctors could learn about her total pain concept. Now to touch base on a few of Cicely Saunders' accomplishments. She became a female doctor at the age of 39 in 1957. And according to Smith, this was at a time when there were very few women doctors. She opened St. Christopher's Hospice in 1967, which was dedicated to research and the compassionate treatment of dying, and it is still open today. In 1989, she was awarded the Order of Merit by the Queen of England, and this is the highest award that can be earned in England. She has 85 published papers along with several books on revamping the hospice movement. I have shared with you three aspects of Dame Cicely Saunders' life, and I have given you a brief background of Cicely Saunders by telling you about her education, the motive for starting the hospice movement, and some of her life accomplishments. I could not imagine having to drink a concoction such as the Brompton cocktail in order to treat my physical pain, to help relieve that during my dying days. I could also not imagine being left to work through my spiritual, social, and psychological pain without any acknowledgement that it exists.